In this Wolf video, I will show you the fields to validate or update for patient attachment and patient verification. When patients check in at a clinic, it's ideal to have a systematic process for validation. In the patient maintenance screen, that's this screen right here, ensure you have checked the following fields. You want to make sure the name is correct here, check their complete address, their phone number, their PHN right here, birth date. Also, make sure you double check that gender. Sometimes that can cause problems later for you down the road for searches. That's when you go to search your system and you find that you have males due for mammograms. You also want to check the primary service provider. So the question you would ask your patient is, who do you consider your regular family doctor? In this case, it's listed as Dr. Barbara McCaffrey. There are other physicians in the clinic. They would be listed in the drop-down menu. If the patient indicates something other than what you've got listed here, either you need to make the change, but also let your physician know that this person has identified another physician. They may want to discuss that with their patient in terms of continuity. Another spot you want to double check here is the patient's status. Now this patient does not have a status, so all we would do is select new status, and then from the status this appears here, and in the drop-down menu this is a list here of all the ones that are configured for this clinic. Now this list is configurable. That's described and talked about in another video, so I won't go into that here, but all you need to know here is generally if you have a patient who is attached to your physician, you'll often choose office patient. Now, there are some statuses in here that are considered inactive patients. That would be people like left practice or unfortunately have deceased. Or also if you've actually intentionally marked them as inactive, meaning that maybe they haven't seen your physician in greater than 3 years. So in this case, we're going to select office patient, and we're going to save that status, just like so. Now, coming back to this name and address screen, which is the one we were in before, you'll notice down here on the bottom right-hand side there is a patient data verification. And this little tick box here, it says patient data verified. Now, by ticking this box, you are indicating that you have checked all those things I have just described. So once you click it, the date will appear down here and it'll stamp today's date, and that will stay there until it gets verified again. This field is searchable, and you're able to come up with a patient validation rate with it. And that is how you check and validate your patients.